So what we did with the pathway was we got together medical professionals, but we also had a patient group really trying to draw together the expertise on various areas, not just from a medical perspective, but nursing, therapy, orthotics. And often these patients will have quite complex orthotics, pain needs. Sometimes they need the respiratory physician for non-invasive ventilation. And the pathway really tells that story, listening to our patients. And so the important bits of the pathway are that patients have a referral from their GP and are referred to a specialist centre like the Lane Fox Respiratory Service to have a good diagnosis. But really it's about identifying patients' needs, their impairments, functional barriers, and things that we need to manage and develop a really good care plan. And that care plan can be developed more locally. And that specialist assessment is really an MD, one of that is MDT, and really co-partnering with patients and help educating them, empowering them in their lifelong care and to be able to navigate the health system. Often patients will see their GP or have seen the neurologist and had a diagnosis, but they feel adrift sometimes that they don't get the practical help and also the way of managing their disability. Often these patients have severe fatigue, new weakness, they might have struggle walking, difficulty living in their home environment, and may have to use a wheelchair. Some are very severely disabled from birth and may develop more respiratory problems. So that's really what the pathway is trying to address. It's clearly stating what the pathway is, standards of care, and how specialist services should run. And we're really trying to empower the patient to be able to, travel along this pathway.